welcome back to our channel. I hope you are doing well today. Today, we have a very important topic to discuss, one that affects many women around the world: ectopic pregnancy. I have seen many cases of ectopic pregnancy come through my doors, and today, I'd like to share with you the story of one courageous young lovely lady, Tanya. I highly recommend staying until the end of the video. It has been carefully crafted with considerable effort, and I believe it will provide valuable and informative content for you and your loved ones. In the heart of a bustling city, a young woman named Tanya found herself on a life-changing journey. This is a story of hope, strength, and resilience as Tanya faced the challenges of an ectopic pregnancy. Tanya, a vibrant and cheerful soul, was over the moon when she discovered that she was expecting a baby. Her excitement filled the air as she and her partner eagerly prepared for their little one's arrival. But amidst the joy, Tanya began to experience mysterious pains in her abdomen and noticed spotting. Alarmed, she knew something wasn't right. Concerned for her baby's safety, Tanya rushed to the hospital with her partner seeking answers. The doctors worked diligently to determine the cause of Tanya's distress. Soon, she received the heartbreaking news: an ectopic pregnancy, where the fertilized egg had implanted outside the uterus. The realization brought tears to her eyes, as she grappled with the unexpected turn of events. She asked the doctor to clarify the meaning of the ectopic pregnancy. An ectopic pregnancy is a pregnancy that happens outside of your uterus. This occurs when a fertilized egg implants in a location that can't support its growth. An ectopic pregnancy most often happens in your fallopian tube, a structure that connects your ovaries and uterus. Ectopic pregnancies more rarely can occur in your ovary, abdominal cavity, or cervix. Pregnancies can't continue if they're ectopic because only your uterus is meant to carry a pregnancy. Ectopic pregnancies can become life-threatening, especially if your fallopian tube breaks, ruptures. This is a ruptured ectopic pregnancy, and it can cause severe bleeding, infection, and sometimes death. This is a medical emergency. Healthcare providers must treat ectopic pregnancies quickly. An ectopic pregnancy happens when a fertilized egg implants outside of your uterus. The egg is meant to travel down your fallopian tubes and embed itself into the wall of your uterus, where it can develop. In an ectopic pregnancy, the egg implants in one of the structures along the way. The most common place this can happen is inside your fallopian tubes. The majority of ectopic pregnancies happen here, about 90%. Ectopic pregnancies occur in about 2% of all pregnancies. The early symptoms of an ectopic pregnancy can be very similar to typical pregnancy symptoms. However, you may experience additional symptoms during an ectopic pregnancy, including vaginal bleeding, pain in your lower abdomen, pelvis, and lower back, dizziness or weakness. If your fallopian tube ruptures, the pain and bleeding could be severe enough to cause additional symptoms. These can include fainting, low blood pressure, shoulder pain, rectal pressure, or bowel problems. When a tube bursts, you may feel sudden, sharp lower abdominal pain. This is a medical emergency. You should contact your healthcare provider or go to the emergency room immediately. In most cases, conditions that slow down or block the movement of the egg down your fallopian tube cause ectopic pregnancy. This could happen because you have scar tissue, adhesions, or inflammation from a prior pelvic surgery. Your fallopian tubes have damage, such as from a sexually transmitted infection, STI. You were born with an irregularly shaped fallopian tube. You have a growth over there which is blocking your fallopian tube. How do I know if I'm at risk of an ectopic pregnancy? There are several risk factors that could increase your chance of developing an ectopic pregnancy. You may be at a higher risk of developing an ectopic pregnancy if you've had a previous ectopic pregnancy. You may be at a higher risk of developing an ectopic pregnancy if you have a history of pelvic inflammatory disease, PID, an infection that can cause scar tissue to form in your fallopian tubes, uterus, ovaries, and cervix. You may be at a higher risk of developing an ectopic pregnancy if you have had surgery on your fallopian tubes, including tubal ligation, or on the other organs of your pelvic area. You may be at a higher risk of developing an ectopic pregnancy if you have a history of infertility and have undergone treatment for infertility with in vitro fertilization, IVF. You may be at a higher risk of developing an ectopic pregnancy if you have endometriosis or have had sexually transmitted infections. You may be at a higher risk of developing an ectopic pregnancy if you had an IUD in place at the time of conception or have a history of smoking tobacco. If you realize that you're pregnant and have an IUD, intrauterine device in place or have a history of a tubal ligation, having your tubes tied, contact your healthcare provider right away. Ectopic pregnancy is more common in these situations. Your risk can also increase with age. People over age 35 have a higher risk than people under 35. Up to 50% of people who experience an ectopic pregnancy don't have any of the above risk factors. An ectopic pregnancy is a medical emergency. Your uterus is the only organ that can hold a growing fetus. It can stretch and expand as the fetus grows. Your fallopian tubes aren't as flexible. They can burst as the fertilized egg develops. If this happens, it can cause severe, life-threatening internal bleeding. This is dangerous. An ectopic pregnancy needs to be treated right away to avoid injury to your fallopian tube and other organs, internal bleeding, and possibly death. Most people don't know that their pregnancy is ectopic until they visit their pregnancy care provider for a prenatal appointment, blood work, or ultrasound. Your provider may suspect an ectopic pregnancy based on what happens at this appointment. To diagnose an ectopic pregnancy, your provider will perform several tests. This may include a pelvic exam and confirmation of pregnancy. These tests include a urine test. This test involves either peeing on a test strip or into a cup in your provider's office and then having a test strip dipped into the urine sample. A blood test. Your provider may test your blood to see how much of the hormone human chorionic gonadotropin, HCG, you have in your body. Your body only makes HCG during pregnancy. A low amount may indicate an ectopic pregnancy because HCG levels increase dramatically when a fertilized egg implants in your uterus. An ultrasound exam. An ultrasound uses sound waves to create a picture of your body's internal structures. Your provider will use this test to see where the fertilized egg has implanted. Once your provider has confirmed an ectopic pregnancy and determined where the fertilized egg has implanted, they'll discuss a treatment plan with you. An ectopic pregnancy is an emergency and treatment is very important. How soon would you know if you have an ectopic pregnancy? Ectopic pregnancy is typically discovered early in pregnancy. Healthcare providers usually diagnose ectopic pregnancies in the first trimester, up to 12 weeks of pregnancy. However, most people discover they have an ectopic pregnancy around 8 weeks of pregnancy. How is an ectopic pregnancy treated? Healthcare providers treat ectopic pregnancies with medication or surgery. Methotrexate for ectopic pregnancy. In some cases, your provider may suggest using a medication called methotrexate to stop the fertilized egg from growing, ending the pregnancy. The medication shouldn't damage your fallopian tubes. You can't use this medication if your fallopian tube has already ruptured. Your healthcare provider gives you methotrexate as a single injection. This option is less invasive than surgery, but it does require follow-up appointments so your provider can monitor your HCG levels. It's important to have consistent follow-up in these cases. In rare cases, a second injection of methotrexate is necessary if HCG levels don't decrease enough with one dose. Talk to your healthcare provider about the possible side effects and risks of methotrexate so you know what to expect. Your provider will want to remove the ectopic pregnancy with surgery if your fallopian tube has ruptured or if you're at risk of rupture. This is an emergency surgery and a life-saving treatment. The procedure is typically done laparoscopic under anesthesia. The surgeon may remove your entire fallopian tube with the egg still inside it or remove the egg from the tube, preserving your fallopian tube. It depends on table situation. You can't prevent an ectopic pregnancy. However, you can try to reduce your risk by following good lifestyle habits. These can include not smoking, reaching and maintaining a healthy weight, and preventing any sexually transmitted infections. Talk to your healthcare provider about any risk factors you may have before trying to become pregnant. Most people with a past ectopic pregnancy can have future successful pregnancies. There's a higher risk of having ectopic pregnancies after you've had one. It's important to talk to your healthcare provider about the causes of your ectopic pregnancy and what risk factors you may have that could cause a future ectopic pregnancy. Although pregnancy may happen quickly after treatment, it's often best to wait about 3 months. This gives your fallopian tube time to heal and decreases the risk of another ectopic pregnancy. In most cases, you can still have a baby if you've had one of your fallopian tubes removed. Most people are born with 2 fallopian tubes. Only 1 fallopian tube is necessary for a pregnancy. Eggs can still travel down your remaining fallopian tube. There are also assisted fertility procedures like IVF that don't involve your fallopian tubes. Have an open conversation about your thoughts on future pregnancies with your healthcare provider. Together, you can form a plan and discuss ways to decrease any risk factors you may have. Can my pregnancy continue after an ectopic pregnancy? Unfortunately, an ectopic pregnancy is fatal for the fetus and your pregnancy can't continue. Once an egg implants outside your uterus, you can't move it to your uterus. Prompt treatment for an ectopic pregnancy is important. If the egg has implanted in your fallopian tube and the tube bursts, there can be severe internal bleeding. An ectopic pregnancy can be unexpected and scary. You're probably feeling many emotions, including grief, shock, and anxiety. Even if your pregnancy was unplanned, going through an ectopic pregnancy can cause trauma. Talking to your partner, healthcare provider, or a mental health professional may be helpful as you navigate your feelings. In time, you'll heal from an ectopic pregnancy. If a future pregnancy is in your plans, be sure to talk to your healthcare provider about your risk for another ectopic pregnancy. The doctor gently explained the diagnosis of ectopic pregnancy. Tanya's heart sank, and her partner was in shock. Their emotions ran high as they grappled with the unexpected news, feeling the weight of uncertainty and fear. But amidst the tears and overwhelming emotions, a glimmer of hope emerged. The doctor wrapped Tanya and her partner in a compassionate embrace, reassuring them that they were not alone in this challenging journey. In the days that followed, Tanya and her partner leaned on each other for strength, their love and support becoming an unbreakable bond. They found solace in the kindness and understanding of friends and family, who lifted them up with words of encouragement and acts of love. Together, they navigated the path to healing, knowing that each step forward was a triumph of resilience and courage. Though the road ahead was uncertain, they held on to the belief that brighter days were on the horizon. With time, Tanya's heart began to mend, and her partner found the strength to support her wholeheartedly. Their journey through the storm had taught them the true meaning of love, compassion, and the preciousness of life. Tanya's emotional journey served as a powerful reminder that amidst life's challenges, the strength of the human spirit prevails. Ectopic pregnancy had tested them, but it had not broken them. With hopeful smiles and tears of gratitude, Tanya and her partner faced the future hand in hand, knowing that they had grown stronger together. They were determined to cherish every moment and face each new day with love, hope, and unwavering resilience. Tanya's story is a powerful reminder of the strength and resilience women possess. While ectopic pregnancies can be a challenging experience, they do not define a woman's journey towards motherhood. With proper medical care and support, many women, like Tanya, can go on to have successful pregnancies in the future. Today, I share Tanya's story, not only to create awareness about ectopic pregnancy but to remind all women that seeking timely medical assistance and maintaining a healthy lifestyle are the keys to overcoming such challenges. Thank you for joining me today as we explore the world of ectopic pregnancy through Tanya's story. If you or anyone you know is experiencing similar symptoms, please don't hesitate to seek medical attention. Remember, together, we can create a more informed and supportive community for women's health. If you found Tanya's story touching, don't forget to like and share this video with others. Subscribe to our channel for more inspiring stories and valuable information. Until next time, stay strong and cherish the miracles in your life.